Primary care providers are often serving the positions of frontline behavioral health specialists because families trust their primary care providers, and primary care providers are often the very first ones to hear when things aren't going well.
Primary care physicians play a critical role as a port of entry for the health and well-being of young children and their families. They're ideally situated to connect with families in obtaining not only health care for the child, but mental health care for that child and family.
Charlotte? Okay. So we're gonna come right back here, okay?
Early childhood behavioral health integration activities can really be captured in 4 different domains. So the 4 domains are screening processes, including identifying when there are concerns or delays or challenges.
Let's see how much you weigh. Let's see how big you are.
In primary care, we do a lot of screening, and that's a wonderful opportunity for us to find out more about what's happening with a family and to also better understand how we can be most supportive. When parents bring their kids to the doctor, they want to hear that you're doing A+ Gold Star parenting from us. And so it can be hard sometimes to find out what else is going on that might be a challenge or an opportunity for us to provide them with additional support or to connect them to the right kind of resources.
One that we use frequently is called the Ages and Stages questionnaire. And what's great about that is that there's not only a screener for developmental milestones, but there's an Ages and Stages social emotional screener, so that physicians can begin to use common language about social emotional development. And so this screener has different items that a physician can then use as a jumping off point to have this conversation with parents.
When we think about other activities in early childhood, the second domain is prevention and health promotion activities, so things that are related to typical development or concerns with tasks of daily living.
Hi, how are you today?
The most common ones that we see are around attention disorders, so ADHD, also issues around development that could be eventually diagnosed as an autism spectrum disorder. But there are also the small run-of-the-mill day-to-day behavioral issues are the ones that we probably see the most.
We are so fortunate that in our clinic we're able to provide a health prevention and promotion program called Healthy Steps. Healthy Steps is a wonderful program for children birth to 3, and there's no criteria to be eligible for it. So we're able to meet with families at their first visit with us, sometimes at 3 days old, and if they're interested in the program, offering them to have a behavioral health clinician join their pediatric primary care well child visits from that very first visit up until they turn 3 years old.
Well, luckily we have some behavioral health providers in our clinic, and I can go grab one of them to come and chat with you in Charlotte today. Does that sound okay?
Yeah. The third domain is probably what we most traditionally think of when we think about behavioral health in primary care settings, and that's the consultation or intervention. It's more of a problem-based approach where the family or the primary care provider identifies a concern that has to do with mental health behavior or development.
Hi guys, I want you to meet my friend. This is Dr. Talmy. She's one of the behavioral health providers here.
Having an integrated behavioral health team in our office is incredibly beneficial for the family because it provides a one-stop shop for a family to both address the physical health needs and the behavioral health needs. And for some children, the behavioral health needs are greater than the physical health needs. So being able to address all of those in one visit is a wonderful thing for a family.
PCPs have an amazing opportunity to support parents by validating their concerns, by taking it seriously. Not only does that reduce the stigma, that can happen at a time in the child's life where it's more cost-effective to intervene early, where changes can happen because development is happening so rapidly that more serious concerns can be redirected, and new skills and capacities can be supported to be developed in the young child's experience.
And then lastly, what primary care providers know and do a lot of is the care coordination and systems navigation for families, and so that's the fourth domain.
One of the benefits to having a fully integrated behavioral health provider be a part of your team is they're there to share the experience of the family with you, but also the load around managing a lot of really complicated factors. It's really common for a medical provider to come and find me and say, I try to cover this with the family. I think that they still have questions or concerns. Are you able to go in and talk to them about why managing their pregnancy-related mood symptoms are so essential to their child's optimal health and development? And then I'm very happy to go in.
The best advice that I have to providers that don't have access to a behavioral health provider in their office is to make relationships in their local area with the behavioral health providers, reach out, even a phone call goes a long way to really know and get a really good feel for the providers in your area who see children and families.
All of this work, and particularly in early childhood, is focused on relationships. It's the relationships between the primary care provider, between you and the families that you're seeing. It's the relationship between the parent and the young child. It's the relationship between you and the community as a hub of medical care that is now not just a hub of medical care, but is really being a medical home that is including mental health, behavior, and development.
We're a team and we're here to support you in a full and really comprehensive way. And sometimes I'm there to kind of fill that gap and let the provider know, I've got this for you. We're gonna manage this. I'm gonna make some recommendations and referrals, circle back to you as the provider, but you're able to go on to your next patient and move through your schedule.
Say bye-bye for
Bye,
10.
guys.
Say bye. Can you say bye?
Thank you.
Say bye.
When we focus on early childhood behavioral health integration, we have an opportunity to help establish strong relationships that last a lifetime, where families know that they have a safe and supportive place to bring their children to get the kind of care that they need.